Now let's talk about the cerebral cortex. Generally speaking, the cortex is split into 4 lobes. The frontal lobe contains the precentral gyrus, containing the primary motor cortex. The dominant hemisphere contains Broca's area, which produces speech. The parietal lobe contains the postcentral gyrus, containing the primary somatosensory cortex. The occipital lobe primarily mediates vision. Now, the temporal lobe is important for hearing. The dominant hemisphere, usually the left, also contains Wernicke's area, which is used for comprehension of speech. Broca's and Wernicke's areas communicate to each other via the arcuate fasciculus. Lesions in the arcuate fasciculus present with problems repeating sentences. The homunculus is basically a map correlating an area of the brain to the body part it corresponds to. There is both a motor homunculus along the precentral gyrus and a sensory homunculus along the postcentral gyrus. It's not correlated to the size of the organ, but rather to the amount of brain tissue devoted to controlling a particular area. That is why certain areas, like the hands or the face, are disproportionately large. Generally, just remember that the legs are medial, the hands are in the middle, and the face is most lateral. There are quite a number of brain lesions listed here, and hopefully you'll have some time to review this chart in your book. I'll mention a few. Kluver-Bucy syndrome is rather famous. When the amygdala is damaged bilaterally, this syndrome consists of hyperorality, hypersexuality, and disinhibited behavior. If there's damage to the right parietal lobe, you end up with something called spatial neglect syndrome. In other words, there's no understanding that a contralateral side of the world exists. The Wernicke-Korsakoff syndrome involves bilateral lesions in the mammillary bodies in patients who abuse alcohol. The Wernicke's part of this syndrome consists of confusion, ophthalmoplegia, and ataxia. That's a classic triad that you should definitely know about. Confusion, ophthalmoplegia, ataxia. Then it can progress to Korsakoff. Korsakoff is where you start to get the memory loss, confabulation, as well as personality changes. We talked a bit already about damage to the basal ganglia and cerebellum. Damage to the subthalamic nucleus is responsible for causing contralateral hemibolismus, a very classic brain lesion. The hippocampus, as you know, is critical for memory, so lesions to the hippocampus cause anterograde amnesia, an inability to make new memories. These next two deal with vision. Damage to the paramedian pontine reticular formation, the PPRF, will end up causing the eyes to look away from the side of the lesion. If, on the other hand, you damage the frontal eye field, which is by the premotor cortex, you get the opposite result, and the eyes would actually look toward the lesion. Central pontine myelinolysis is classically caused by a rapid correction of hyponatremia. The osmotic shift will cause damage to the pontine neurons, which leads to acute paralysis, dysarthria, dysphagia, double vision, and loss of consciousness. The diagnosis can be confirmed using MRI, which would show an increased signal in the pons. Aphasia is the inability to speak due to a cortical lesion, and it must be distinguished from dysarthria, which is a problem with mechanical production of speech by the tongue and mouth. One way you can do this is by assessing the content and grammar of the speech, which is usually normal in dysarthrias but confused in aphasias. Alternatively, written language is preserved in dysarthrias but not in aphasias. Broca's aphasia is also called non-fluent aphasia. These people can understand perfectly but cannot express themselves. Broca's aphasia is usually caused by an infarct in the superior division of the middle cerebral artery of the dominant hemisphere. Wernicke's aphasia is also called fluent aphasia. These people can produce words, but will not be able to string them into a meaningful sentence. Wernicke's is caused by infarcts in the inferior division of the MCA in the dominant hemisphere. Global aphasias occur when both the Broca's and Wernicke's areas are affected. as in a large MCA infarct affecting both the superior and inferior divisions. Conduction aphasias refer to a patient with normal fluency and comprehension, but impaired repetition. This type of aphasia is caused by any lesion along the arcuate fasciculus, the pathway that connects Wernicke's to Broca's. The brain receives blood from the anterior cerebral artery, the middle cerebral artery, and the posterior cerebral artery. The anterior and middle cerebral arteries are derived from the internal carotid artery, and the posterior cerebral artery is derived from the basilar artery. All three arteries anastomose at the circle of Willis. Now, the ACA provides blood supply to the medial surface of the brain. The MCA supplies the lateral zones of the brain, and it's split into the superior and inferior divisions. The PCA provides blood supply to